Okay, hi everyone. This is my 8 months post-op from my recovery from my ACL, LCL and Biceps Fem reconstruction surgery. So I apologize for not being able to post a video for the past few, like almost 3 months now. I have been a little bit busy. So now I would like to update you guys about the progress I have done in my recovery. So finally I have been approved to start running, and I started running on the treadmill, and sometimes I run outdoors, but most of the time I run on the treadmill. So just like a few things regarding when you first start running, it's very important that you do not compensate on the other leg, and this is something that usually happens because this leg is definitely weaker or it's not used to running properly yet. So it's very important that you have a proper form while you are running, and it's also important that you start at a very slow pace, slow speed. Do not rush things. There is no urgency for you to start running at a faster pace. Just start at like a speed that's slow and that's suitable for you, and eventually you will start increasing your pace. So just like a small thing, when you start running, you basically try not to compensate on the leg that's not injured, and have a proper form while you're running, and keep in mind that like during the whole time while you are running, and as I said, maintaining a slow pace will help you to focus on having the proper form. So that's it regarding running. And I will also go quickly through some of the exercises that I have been doing for the past 3 months in order to be able to start running again. So one of the exercises that I pretty much like, it's a basic component of my workout now, is Belgian lunges. So for this exercise you can use weights, you don't really have to. I personally think that bodyweight exercises are more than enough, and it's more important to have a good form in your lunges or in your workout or your exercise than having to add weights and do the exercise while your knees are not stable. So that's the first exercise you can do. You will put your leg on a chair or like maybe a bench or whatever you can find at the gym, and you will start doing Belgian lunges. And make sure you do not lean forward, make sure your legs are not too wide, make sure you do not shake. If you have weights and you feel that you are a bit shaky, then do not do the exercise with those weights. You might need to go to a lower weight or maybe no weights at all. As I said, form is more important. Then you will do sets like 10 reps of each one. And you can change and switch your legs. At this point of your recovery, this is something that's very important. You are at a point where you should start working your other leg too. I know at the beginning you focus on the injured leg because you lost a lot of muscle mass. At that point, do not ignore the other leg. You should do both legs at the same workout. So when you do your left leg or your injured leg, you switch to the other leg, because you do not want to have an injured leg, then once you recover from this one, you have an injury in the other one. Another exercise that I have been doing, and it's actually one of the most useful exercises that I found personally gives like great result, is doing again single leg squats or lunges on a chair or on like something that's like a little bit high. So you will keep your other leg pointing forward like this, and you will basically go into a squat position, and once you touch, you go up, down and up. And then we'll do on the other leg because I have better form in this leg. Again, up and down, up and down, and down. And you shouldn't stay for long on the item that you are using to do the exercise. You should, as soon as you touch, you should come up. So that's one of the exercises that I also have been doing. And of course, you can do balance exercise if you have maintain this position for 1 minute. And as I said, once you finish your injured leg, it's time that you start working out the other leg, and you will switch and do balance on the other leg. You might actually be surprised that you would find out that your injured leg now has better balance than your other leg. So it's very important that you work out both legs. So you hold the position for 1 minute or whatever you can do. And maybe that's all for this week's video. Hopefully by next week I will show more of the other stuff that I can do. One more thing also, if you feel stiff while you start running, it would be good for you that you maybe cycle for like few minutes, 5 minutes or something, to warm up your muscle before you start running. So that's all for this week, and hope to see you in the next video.